The effects of the autonomic nervous system on heart rate are called chronotropic effects, and changes to the heart rate affect cardiac output in a complex way. Along with stroke volume, heart rate also plays a role in determining cardiac output, and that's because the cardiac output is the product of the stroke volume and the heart rate. So, in general, increased heart rate leads to increased cardiac output, but there are some caveats to this relationship. The autonomic nervous system is an important regulator of heart rate, and stimulation of the sympathetic nervous system increases heart rate, while stimulation of the parasympathetic nervous system decreases heart rate. This graph depicts the true relationship between heart rate and cardiac output, and as expected, increases in heart rate generally lead to increases in cardiac output, but this relationship isn't exactly linear. And as we'll see, that's because changes in heart rate can also affect the stroke volume. So at very low heart rates below 40 beats per minute, there's generally a proportional increase in cardiac output with an increase in heart rate. But then at heart rates in the range of about 40 to 90 beats per minute, the effect of increasing heart rate on cardiac output is relatively small, and the slope of this line isn't very steep. That's because at rates in this range, when the heart rate is increased, there are shorter periods of diastole and therefore shorter periods of ventricular filling. This decreased filling leads to a decrease in preload, which in turn decreases stroke volume. That decreased stroke volume counteracts the increased heart rate, and that dampens the effect of a change in heart rate on cardiac output. With a higher heart rate between 90 and about 160 or 170 beats per minute, cardiac output increases proportionally to increases in heart rate. So the increased heart rate is the driving factor here. Then above about 160 or 180 beats per minute, cardiac output actually starts to decrease as heart rate increases. That's because at these very high heart rates, there's very little time for ventricular filling. So there's a very low end diastolic volume and therefore a drastic decrease in stroke volume. And in this range, the stroke volume falls faster than the heart rate increases, and the result is a decrease in cardiac output that further increases in heart rate can't correct.